Hello, everyone, and thank you for joining us. My name is Marcia Wessel, and on behalf of IntelliSoft Group, I'd like to welcome you to the continuation of the Payer Enrollment Institute series with today's webinar, PE 201 Guided Steps to Successful Enrollment. The program will be presented by three industry experts, Donna Gestenkors, Dina Solis, and Yesenia Servin, and is brought to you in collaboration with Team Med Global and sponsored by the Massachusetts Association of Medical Staff Services. For those of you who may not know IntelliSoft Group, we are a leading provider of credentialing, provider enrollment, and contract management software. We also have an NCQA certified CVO division that can help with either temporary or full-time assistance for a number of services, including PSV and enrollment. A few housekeeping items. The dialog box located on the right-hand side of your screen is very helpful for a number of reasons. For instance, the PowerPoint, Certificate of Participation, and NAM CEU for today's program are all available for download in the Handouts section. You can download these at any time during the program. Also, if you find it difficult to hear the presenters, you may find it easier to call in on the phone number listed in the audio section of the dialog box because sometimes computer speakers aren't ideal for sound. Finally, there will be a live Q&A at the end of the webinar. Because we have so many attendees, we request that you submit your questions in the questions section of the dialog box. Now it is with great pleasure that I introduce our friend and today's first presenter, Donna Gestenkors. With over 42 years experience in the medical staff services industry, many of you may know Donna or have worked with her personally. And with that, I'll turn things over to Donna.
Wonderful. Thank you, Marcia. And just from a housekeeping perspective, Marcia, I want to make sure that everybody is hearing what we're saying and they're able to see my screen, because on my screen there still is a box that says attendees are on hold. Should I disregard that?
You can disregard that. Everybody is listening to the program.
Cool. Thank you. Hello, everyone, and welcome to our almost 500 listeners and participating in this education series specifically dedicated to the fastest growing membership area within the medical staff services industry, payer enrollment. This progressive series will take MSPs and enrollment professionals through introductory theory, which was our previous session, to the first of its kind application of this theory by following a branded illustration of a best practice process model, which is going to be today's session. And then we're going to be following in sharing challenges and solutions, which will come up in September. And then subsequent to those sessions, we're going to be providing to you comprehensive training, which will target areas within payer enrollment like commercial enrollment, government enrollment, equipment, locum tenens enrollment, and non-physician enrollment, and so much more. So stay tuned and look for the Dr. FBI flyers and my social postings so you don't miss a session. As Marcia mentioned, my name is Donna Gestenkors. Excuse me. My name is Donna Gestenkors, and I'm not able to advance my, oh, there we go. My name is Donna Gestenkors. Hi, everyone. The third time's a charm. And I'm proud to share this webcast stage with my fellow experts in payer enrollment, Dina Solis. Dina and I have worked together on various enrollment projects now for over 5 years and are honored again to have been selected to present at this year's NAMS conference by hosting a payer enrollment town hall meeting. So if you want to hear and learn about various practice solutions addressing key payer enrollment areas, you be sure to register for our session, which is going to be held on Tuesday. Dina, how about sharing with our attendees one of your very warm greetings?
Thank you, Donna. Hello, everyone, and happy Tuesday. Thank you for joining us today. I'm excited and honored to be co-presenting another Payer Enrollment Institute webcast with Donna and IntelliSoft, and a first time with Yesenia. I look forward to sharing some great information. And with that, I will introduce Yesenia Servin, newest member of our team. Yesenia, if you'd like to make a few comments and introductory welcome.
Yes,
thank you so much,
Yesenia, before you do that, let me please just tee up this particular slide. As Dina mentioned, Yesenia is the newest member of our team, and she was brought on board due to the recent release of our payer enrollment, education, training, and staffing institute. So we are really pleased that someone with Yesenia's experience in enrollment is part of our team. And so with that, Yesenia, may I please ask that you just give a brief highlight for those attendees to have an opportunity to get to know a little bit more about yourself.
Thank you, Dina and Donna. I'm very excited and grateful that I get to join you both and everyone in attendance. I have several years of provider enrollment experience, and I truly enjoy assisting practitioners and organizations that are seeking to start a practice, grow their practice, or figure out what went wrong in their practice with provider enrollment. And a big part of what we're going to show you today is a great presentation that will also help with all your provider enrollment questions and startups.
Wonderful. Thank you, Yesenia. All right, so as Marcia mentioned, the collaboration of this Dr. FBI series has exclusively been with IntelliSoft. And because of the generosity of the IntelliSoft group, all of us listening on the phone today, participating in this series and other series, are being provided complimentary education from across this great country to all of our colleagues for over 8 years now. So we sincerely are grateful for your ongoing loyalty, and we will keep producing high quality education for your learning pleasure. Now, today's session will really target the payer enrollment model and how you can use that to tweak your practices and help you develop your policies and procedures. And we're also going to provide you tips that will help you improve communication with those payer representatives to really shortcut that enrollment turnaround time. So with that, let's get started. And this is really where the meat of the program comes together. There's always an appropriate introduction to kind of get people settled into their space. And this first slide about preparing yourself really does help us get our minds into the journey of the information that we're going to be sharing today. Now, some of you have been so loyal in following Dina and I previously. Some of the information that we're going to share about this process model will be familiar to you, but please know there's also new information. So it's always good to be reinforced what it is, the messaging and the learning and those knowledge gaps by hearing things in a repetitive manner. So really, it's this program is really for the benefit of all of those participating today. As we look at this message in the Prepare Yourself slide, it really is conveying that payer enrollment success, for us to truly be successful in performing the skills necessary to do payer enrollment, it's not really all about understanding the theory and the process, but we have to have that attitude of wanting to be helpful to all of the stakeholders so we can work together to accomplish the goal about getting our practitioners and our organizations enrolled into our various health plans to maximize reimbursements, because really it is about the money and how practitioners and organizations can stay as viable as possible. So as we try to do with every skills-oriented program, we give you this measurement of MSP competence, the knowledge that we acquire through programs such as this, the skills that we practice every day to improve what those knowledge gaps are and the process by which we perform our skills, and then our ability to demonstrate how we put the knowledge that we learn and the skills that we practice really defines our competence. And our competence for MSPs can be found in these three pillars: how efficient we are in performing our payer enrollment skills, how well we're able to interact with our other stakeholders makes us powerful in advancing our careers and really excelling in our competence. So with that, let's look at skills. Enrollment management, as you see on the slide before you, is in black bolding because the topic for today focuses on payer enrollment. The other areas, MSPs throughout any industry or throughout any area of specialty within our industry, these are other core competencies that we must be familiar with. But the other two black bolded management cores are technologies and relationship building, because those go hand in hand with how effective we're going to be able to perform our enrollment skills. So when we look at enrollment and credentialing, it's important for us to reinforce, and many of you have heard this before, but let's just reinforce quickly for those who have not had that opportunity in defining what the difference is between credentialing and enrollment. Credentialing, for those of us who are MSPs and experts in our credentialing verifications, credentialing is the process of verifying a practitioner's credentials and competency to validate that they are indeed competent to perform the privileges that they are requesting. And conversely, when we're looking at enrollment, we want to understand that enrollment is really about applying to health plans and networks so they can be approved into their panel, and that they can bill to these health plans so that organization or that practitioner indeed is going to get compensated as an in-network provider for the services that they're providing. And when we want to just drill down to the two core important facts about enrollment, we have to accept these as practice facts. We cannot enroll practitioners until the credentialing and privileging components have been completed. So collaborating with those professionals in that arena will be critical. And then the second component is when we do not manage our credentialing function properly or the enrollment function properly, it will have a negative impact in the reimbursements that are going to that practitioner or to that organization. So really, how we bridge that gap is to improve how we're onboarding these practitioners, making sure credentialing and enrollment is a part of the discussion and part of the team, and how we're putting these practitioners within the practice of providing their services. So that kind of lays the foundation, right, of payer enrollment. And now I'm going to ask Yesenia to kind of walk us through the high level of our enrollment process model. And then Dina is going to drill down into specific examples for each of those steps. So Yesenia?
Yes, thank you, Donna. And if you wouldn't mind, if we could go back just one slide, I'd like to say a little short anecdote about what happened in an organization that called me about September 2017. Small organization of 12 practitioners reached out to me because they were being rejected, and numbers and rejections were up to 120,000. They had no idea what happened, what was missed, and it was in fact their credentialing and enrollment had been missed, and they were still taking in patients. So the numbers were only going to increase because the credentialing and enrollment were still not fixed and needed to be immediately stopped before proceeding on taking more patients and growing that deficit even larger. And that's only a practice of 12 people. So imagine the level of hospitals and health systems that we work with, the numbers, how huge those are. Okay, thank you, Donna. We can move on to the next slide, which is my slide we'll jump right into. The payer enrollment model. And the three that fall under our payer enrollment model are first the federal and Medicare, and TRICARE falls under this number one as well. Number two is the state and Medicaid. And number three is our private and commercial networks. There are other networks like an employment assistance program, workers' comp, independent physician associations that don't quite fit under any of these three, but for today's presentation, this is the three that are listed that we're going to focus on today. We will review the pre-enrollment and post-enrollment process models. So what is included in our pre-enrollment process? Determine which plans to enroll. Sometimes you have to do research, sometimes they're predetermined for you. Number two, contact payer and ask questions. Yes, we love questions. Collect provider information and documents. Obtain and complete application. Prepare your letter of interest. Submit enrollment packet to payer. Follow up on determination until the determination is made. And number 8, hopefully you won't have many of these. It'll be few and far between. Network denials. What will you do next? What is the process for post-enrollment? Obtain proof of enrollment. Sometimes this can be tricky, and we'll go into that a little bit because some networks like to give you a verbal enrollment and then you have no documentation anywhere, no confirmation number, but Dina will get into that a little bit. Implement with billing department. Record, load, new contract and database. Number 4, maintenance for continued enrollment.
And Yesenia, before we go on, I just would like to pause here for a moment for our listeners. This pre and post-enrollment model that Yesenia just covered is being used. This is the feedback that we're getting from the industry. It is being used to help provide structure for those people newly coming into payer enrollment so they can understand the steps that they're taking and kind of what bucket their steps are falling into. As opposed, it seemed to be very convoluted before this model. People were going through the steps, but they really weren't understanding what part of their process or what step in the process their steps were taking them or their process was taking them. And the feedback that I've also gotten is that it is helping organizations to develop policies and procedures based upon this structure. So it has been a great foundational tool for our industry. So with that, Yesenia, would you like to please talk to us about the next steps?
So our next steps, we can move on with our slide. Who do we enroll? Well, within a large healthcare system, as you know, there are several levels of practitioners: academic, community, critical access, specialty, clinic, community. Oh, I'm sorry, I said community already. I guess I really like community. We can move on to our next slide. So,
okay.
When you
So,
Dina, go ahead.
oh, okay. I will go ahead and take the next steps. So part of the first step of the pre-enrollment process is to determine which plans to enroll. Like Yesenia said, these can be predetermined based on your organization. You may have a list of plans to enroll in. You may have to research it yourself. So if there is no list and you need just a resource, one that I've found helpful with my clients is the AIS Directory of U.S. Health Plans. And if you're not familiar with it, you can visit their website to find out more information. If you are familiar with it, it is a little costly. So it could be cost prohibitive, but the information at that link and that directory I found to be very helpful. I did bite the bullet and purchase a copy of it, and it's got all the contact information for the health plans broken down by state, what their demographics are, the types of plans that are out that the payer offers, etc. For Medicare enrollments, you would go to CMS for their applications and be directed. You can find information about PACOS. And then also for Medicaid, you can go to the state's Medicaid website, and there you would find also information on the managed Medicaid HMO plans. That would be helpful in determining which plans to enroll.
Hey, Dina, may I please ask how much, for the benefit of our listeners, how much is that AIS Health?
Well, I'm not sure what
directory?
Current pricing. Back when I purchased it a few years ago, I want to say it was around $3,000. But I was I've been able to use that information, and it's actually, I've been able to recoup the cost of it just through my own client base, because it's been that helpful for me. Just the clients that have come to me and said, I'm not really sure which plans to enroll. Can you help me determine what payers are in my area? So.
So really worth the investment is what you're saying.
For me, it was. It could be, and for me, it was. I think they offer some different methods of obtaining the information, such as like a cloud-based subscription that might be more cost-effective. There could be the USB. They might send you a USB. They could have downloads now. But when I was purchasing a few years ago, it was more of CD and a book. So so it is. I found it very helpful.
All right, so that was our first step. How about if we go into step 2?
Okie doke. So the next thing you'd like Yesenia touched on is to contact the payer and ask some questions. I do this no matter what payer I'm working with typically, just because I want to be up on the current, whatever might be current with that payer since the last time that I worked with them. I could be working with a different provider type. So I always make sure that I ask this bullet list of questions. If there's any requirements, any special enrollment fee, what their time frame is, that's really important. And sometimes, that's kind of a fluid question to ask, because the payer could say, well, we usually process our enrollments within a certain time frame, and then it could end up being longer. So just finding out kind of a time frame I've found to be very helpful. I always make sure that I ask what their preferred submission method is, and what would be the most efficient way to have the enrollment process. This would be, of course, if you're dealing with provider types and payers that are not using CAQH. If you're actually having to submit something, a document or something, not through their web portal. If you're needing to submit an actual paper document, I always ask if the payer accepts if the payer accepts enrollment applications through a mailing address, so I can get send via FedEx, and if so, what's the street address and the phone number that you always include on FedEx or overnight couriers. And then also, I always ask if they accept CAQH, if they permit backdating. That's I found very helpful in cases where a provider might be starting to see patients. Some payers will backdate to the effective date of a license. Some payers may backdate to the date you've submitted the application, so it's always good to find that out. And then I also have clients who ask me to find out what their reimbursement, reimbursements may be like for the services that they're providing. So sometimes I ask for a fee schedule, extra forms. If I'm dealing with an out-of-state provider, it's always helpful and a good practice to ask if they allow out-of-state providers, because some payers will not. And I find this in Medicaid, state Medicaid payers. Sometimes they have different policies and procedures related to out-of-state providers. So it's always very good to ask about those policies and procedures. And when you're asking about out-of-state providers, this bullet point is helpful just in knowing that the payer could have different payment methodologies if the provider is located out of state. So when I say primary versus crossover, this is a question that I've asked their payer enrollment, like state, for example, a state Medicaid, I've had to ask if that Medicaid allows out-of-state providers, and if so, what would be their payment methodology? Would that Medicaid reimburse the provider as a primary for primary payments versus crossover to Medicare only? I can, if there are questions around this, I'm happy to answer questions after the program. But that I have run into situations where providers, once they're enrolled as an out-of-state, they can only qualify for being a crossover provider to Medicare for payments, and that can affect managed Medicaid enrollments as well. So again, if any questions around that, feel free to contact me. And then advancing to the next slide, the next step in our pre-enrollment process is to collect the provider information and documents. So you would go through and gather up pretty similar information to the what's collected in the credentialing process. You would review and make sure that all of your documentation is accurate and matches if there are applications versus documents, making sure that checking their addresses and zip codes and make sure everything matches what's on the application. If the provider had to fill out an application, making sure that it matches the information that's on the documentation. And then advancing to the next slide, step 4 is to obtain and complete the application. So here are some application elements. If you're not familiar with an enrollment application, they're very similar to credentialing applications where they ask for identifying information, licensures, certifications, work history, references, practice information, description of their services, professional liability insurance information, and history is always usually asked for. Advancing to the next slide. Billing information, payers would like to typically know in advance who your billing is executed through, if it's through a clearinghouse or a third-party administrator. There are typically attestation questions and disclosures that need to be completed regarding legal history of the provider. Ownership and controlled interest. Payers typically like to know who owns the practice or the group. Information release and acknowledgements are usually included in applications, and those relate to the provider just giving their authorization to release their information to payers. And then there are typically provider agreements within it, the application, and checklists of attachments. So getting into what would be requested for a typical application Again, like with credentialing, it's usually payers would like to see current applicable state and local federal licensure, certifications, registrations, anything that the provider may have. It certainly may not be all of inclusive of that bullet point, but whatever is applicable to that provider's specialty. Payers also like to need to have the IRS CP 575 and or a W-9. So the CP 575 is basically just the proof of taxpayer ID number when the IRS is issued the taxpayer ID number. It's really just a proof. They usually ask for the IRS W-9 dated within 1 calendar year. And then also proof of highest level of education usually are requested.
With regards to those typical application attachments, that really takes us through our first 4 steps of pre-application, but we have more, don't we, pre-enrollment?
We do. Step 5, we are talking about preparing the letter of interest. Oh, sorry.
Oh, excuse me, that's my fault. Here we go.
Okay. Step 5, we're talking about preparing a letter of interest. Some payers will request that you submit information about the provider in the form of a letter. Not all payers do, but if your payer is asking for a letter of interest, the importance of the letter of interest is that it presents and sells the provider to the payer. This can be helpful in cases where the network is limited or narrow or possibly closed for your provider type specialty. It would describe an overview of the services the provider provides, and it can actually help convince the payer to offer enrollment or to offer a contract. So what you would want to do, a best practice in advance, is if they're asking to submit a letter of interest, sometimes I find it helpful to really do a little bit more research. You may get that information through a payer enrollment representative on just a blind call that you make. So sometimes I'll go a little bit deeper and I'll go onto LinkedIn, or I may ask that provider rep maybe who the decision maker might be, and just see if you can get their name or at least their title, because you like to make sure that your information is getting to the right person. So some of the basic elements of your letter of interest, you should keep the letter from 1 to 2 pages. That way payers, they're getting multiple letters from providers requesting inclusion in their network, so just keeping it brief. Your basic elements that payers ask for are the provider's identifying information, their name, their tax ID number, all their basic demographic information. Sometimes they might want to know a little bit of brief company history, or it might be helpful to know if it's a small or if it's a large company that owns the provider, how many years they've been in business. I've found that to be helpful for getting into the smaller regional payers. It helps to add like a personal touch to the provider. Some of the selling elements that you might include in your letter of interest. So this would be helpful for the payer to know if you work with specific hospitals or medical centers that maybe they don't have, maybe they're having a problem with a provider there that they might not be happy with. So I found it helpful to just mention that the provider works with X, Y, and Z medical centers. If that provider has any special attributes that they work with, maybe that they might be minority or women owned, and I've put the certification. If so, there's certifications that are available from the Small Business Administration that can be helpful in securing a contract or an enrollment for your provider. If your provider provides any unique services compared to competitors, that's really helpful to include in your letter of interest. There could be that the provider provides just a certain specialty in a certain geographic area that might be helpful, that might perk up the payer's ears, so to speak. And then also continuing on, your provider, maybe they might serve a special needs demographic, like a low income segment such as Medicaid. The payer may have a need for providers to offer competitive rates that could give the provider a competitive edge. Maybe the provider serves Indian health services patients. Perhaps maybe they might offer DME or home health or hospice. Maybe they may have those referral type relationships already in place. And then lastly, I've had a client where what helped get into the payer's closed networks, where they would offer the payer a trial program. So they would say, let us serve 10 of your patients and see how it might go. See how better we serve your patients compared to other providers. So that just might be ideas for you to take with you after the program and see if you can implement into your organization. And again, some payers may ask for attachments for the letter of interest, and this could be outside of your requesting enrollment. This could be the first step. All payers are different. They might ask for a letter of interest before they even send you a credentialing application. So sometimes they may ask for a letter of interest in the W-9. They might ask for some licensure, maybe some marketing materials. They may ask you for your top billing codes so they can figure out what they might reimburse for those services or those CPT codes. And that can also open a discussion on your rates for negotiation purposes. So sometimes you might be looking, you may be negotiating based off a dollar amount or a percentage of a fee schedule. So it's helpful to get that conversation started through the letter of interest process. And then sometimes payers, this is really rare, but I've had payers ask for invoices on products provided during the negotiation process. So this is something that's rare, but it could be asked for. And sometimes payers will ask for a sample claim form. So step 6 in the pre-enrollment process, we got a lot of steps here. This is just a matter of submitting the application to the payer, which would include your whole packet. You'll want to make sure that you submit it per their preferred method. And then for online enrollments, making sure that you submit all the attachments. Sometimes when you submit an online enrollment, there may be a need to fax some additional documentation. So making sure that you get a cover page, your ATM number, making sure that you keep track of your username and password. These are all just tips to help smooth out that pre-enrollment package and make sure that it gets submitted properly. Going on to step 7 is all of our favorite. We all just love following up until a determination is made. This is just a painful process, but it is very, very, very helpful. And communication is key. It's pretty easy to submit an application and let it kind of go into a black hole and not follow up on it, but it's really helpful to keep following up with the payer. I really had to drill down just yesterday and find out the status of a credentialing application that I submitted to a payer that my client was waiting on, and I finally drilled down and got a hold of the actual person who was processing it and got an answer. So it's really just a matter of following up, responding promptly to any requests for more information, and then just giving updates to your provider. And then when it's approved, you may need to ask for an acceptance letter or a welcome letter. And if you're denied, then we can go to step 8, which is what's next. In a nutshell, you can always ask why and when you can reapply. I typically don't take no for an answer on the first go around. I will always ask my payer, what can we do? Maybe the payer might need more information. You can ask, there are times where the payer may actually reopen their network. And so you can always ask, and you can always ask for a second level appeal. You could say, well, thank you for this response, but is there somebody else maybe I can speak with? Can I speak with find out the decision maker? You can always appeal with supportive letters from patients, some colleagues, or referring physicians, depending on your provider type. So never take no for the first answer is always my advice. So now going on to, sorry, Donna, go ahead.
Before we go on to the post-enrollment, I really personally even need to kind of take a breath, because that was a lot of information in the pre-enrollment steps, and we had 8 specific steps. And I think the parallel that I would like to draw here from a credentialing perspective, those people who do the verification components every day, we can delineate our steps as well, but there's lots of moving parts. And I think that's really the parallel that I want to draw with the enrollment professionals. We have been able to add structure to your process, but with respect, we know that there are a lot of moving parts. So being respectful of each component of our industry and the respect of our stakeholders, how can we really work together to help facilitate the items that we can use in each of our individual processes. So with that, yes, please, Dina, if you could take us through the 4 steps of the post-enrollment process.
Absolutely. So post-enrollment, you'll want to receive or request the confirmation letter showing the effective date. We've had some feedback in the past that this has been kind of a difficult step in this process, because some payers don't provide a confirmation letter. So we've had questions on what can be done. We've got a couple of suggestions here. You can verify on the website. You can maybe capture a screenshot of the provider directory. I would just say my advice would just to be persistent. If they don't, maybe there's an email that you could get from a provider relations representative that maybe you could save as a PDF. I've had to do that before when I've not received some proof that the enrollment was indeed processed and approved. So it really just depends on your organization and the payer. And then step 2, implement with your billing department. There may be times when, now this may not apply to all enrollment specialists, but you may be asked to assist with electronic funds paperwork and setup, which is really just a one-pager with a copy of a voided check and the bank information of the provider. You may be asked to assist with electronic data interchange, which is basically electronic billing paperwork. Not that you would be doing the billing, but you may be asked as part of a post-enrollment step, how does the provider want to be paid, and then how do they want to bill, and how do they want to receive their remittance advices. You may also be asked to help set up the web portal or be an admin. And you may need, absolutely, you would need, one of your responsibilities should be to communicate with the billing, any stakeholder, revenue manager, internal departments, what the status of the enrollment is, and that it was approved and the payer can be billed. Step 3 in post-enrollment, I will keep this high level and quick. Just a matter of recording whatever your organization typically does with the new contract. You may need to upload executed copies of the agreement, assist with the contracted rates, be the liaison between your billing department for contracted rates, making sure that welcome letter or any information you get making sure that you verify the accuracy of the information of the provider that the payer has on file. Because if the provider is not loaded properly with their information in the payer's network system, that can create billing discrepancies as well. And lastly, step 4, maintenance. So this would be just basically submitting, just keeping up on any changes that a provider might have, making sure that they're submitted timely in accordance to the payer's policies, making sure that responding to updated licensure and insurance requests, tracking expiration dates. This doesn't apply to all enrollments, but some enrollments may have expiration dates related to re-enrollment dates. So making sure that those are tracked if you have a system that tracks that for you, and just making sure that all of your attestations and information is current in CAQH. And with that,
wonderful. Yeah, that was a good walkthrough, truly, of the detail involved in each of the pre and post enrollment steps. But as we move into our next objective for this program, I'm going to ask Yesenia to help me. I'm going to take the first component or the first slide in this particular objective. And Yesenia, I'm going to ask us to rotate from slide to slide, okay? So I'll take this first one. When we're talking about how we can improve our relationship with our payer representatives, it really is important that we identify a go-to person within each of the health plans. So when we have questions or there's a delay in a process, we can pick up the phone and make contact, send an email, make contact with that person, and keeping that line of communication open. As Dina had mentioned, even beginning to maybe reach out to these folks through our social media sources so we can begin to establish a more personal relationship with these individuals. So that's our first tip in improving our communications with our health plan representatives. Yesenia, how about you take the next one?
Yes, follow-up. I am the queen of follow-up. The networks probably know me as Miss Pestering, maybe not Miss Follow-Up. So the one thing that is very important in provider enrollment is the follow-up. You have to make sure at the 7 days to call and receive confirmation that they have received a complete packet from you. If they haven't confirmed that, then you cannot proceed. What you want them to hear is, yes, we have your complete packet. Sometimes they call it, we have received your clean packet, meaning everything's there. They just need to get moving on their side to process it. Excuse me. So after those 7 days, I usually give 15 days after that. So 2 weeks after that and 2 weeks after that. It's almost like a very routine schedule. And back many years ago, it used to be that you would get the same person every single call. It's not that way anymore. The turnover is high in our networks, so you'd have to make sure you try to make every single person you talk to your BFF as you're calling them.
Hey, Yesenia, I'm going to ask a question here because when I'm out in the field, one of the questions that Dina and I actually get so frequently, there's almost like I forget the word, sort of like a swelling within the industry on the ground level of frustration from those payer enrollment specialists because of the constant turnover happening at the health plans. And they are attempting to do this follow-up, but they're not getting callbacks. And they're almost like at their wits' end, they're just not sure what to do. So do you have a strategy or a tip that we can put out to our listeners in that regard?
So even when I am extremely frustrated because of the same exact issue that you're mentioning, Donna, that everyone else is dealing with, I am so friendly. I am sweet as sugar when I call. I ask them how they're doing. I ask them how their week is. I ask them how the weather is in the area that they're working in. And that tends to put them at ease and try to help me. So that has been working for me. It used to be, like we've been saying several times now, I would call, let's say, Donna at X Network. And I know I'd always call her. She'd help me push my stuff through. She'd help me figure it out. And now it's not that way. So be sweet as sugar, even when it's hard.
So internally, they have to be frustrated as well because they're receiving these comments of frustration. So it's sort of like a vicious circle. We have to kind of set that tone of how we're wanting responses. And what I just heard you say is being respectful and kind, even though it's a frustrating experience that we're all going through. And I know that this is also one of the issues that Dina and I are going to be teeing up at the NAMS conference with regards to directly hearing from a health plan representatives what other communication strategies they might have in mind. So with that, the importance of follow-up, then I'm going to touch on verification, understanding that it's important that we confirm all of the information that the health plan lists in the approval in their approval letters or the emails, to making sure that it's correct, because when mistakes are made in data entry or in the credentialing process or the enrollment process, it truly can affect the claims. And how about you touch on communication, Yesenia?
Communication provides status updates to all stakeholders. Yes, so sometimes you will notice that Network X now wants a bank letter versus a voided check. And you know this, but who else needs to know this in your department? So you want to make sure you get the information out to everyone that needs to have the info. Your practitioner, your admin staff, other departments. Communication and attention to detail are vital in getting providers started as quickly as possible. It is important to have credentialing professionals who understand the different ins and outs for each insurance company, so important details aren't missed.
Okay. Perfect. And I'm going to take the next slide and kind of walk us through to the end of the program. And this really goes along with the conversation Yesenia and I had just had about what we can do to really build up those relationships with those health plan representatives. And same with things that Dina and I have shared in the past. Really get to know these people by name. Use your skill as a professional and as a leader to impact the process that you're trying to affect a change in or an improvement in. Stay actively connected with those relationships to be sure that you have a go-to person to help in your process flow or to troubleshoot challenges or questions that come along. Be, as Yesenia said, be as sweet as sugar. Thank them frequently because they too are experiencing frustration, and reach out and connect with them in social media situations. So in a nutshell, in regards to this program, this session 2 of this entire educational platform about payer enrollment, we want to stress the importance of collaborating with other stakeholders. And collaboration really is when 2 or more people are working towards shared goals. And that shared goal is to maximize reimbursements to our organizations and our providers and practitioners through our refined processes. So as I reveal the next couple of closeout slides, I'm going to ask Marcia, our program facilitator, to begin to gather questions. And I'm going to leave you with this thought. At first, people are going to ask you, hey, what are you doing to improve your process with regards to payer enrollment? And then they'll say, how are you doing it? How are you able to get things processed more efficiently or more timely than I am? So really, again, it's about collaboration, sharing our experiences to benefit all. And as I reveal our next program, it's going to be Payer Enrollment 301. And we're going to be talking specifically, meaning the whole hour is going to be dedicated to specific challenges that Yesenia, Dina, and I have either experienced or we're getting from the field, and solutions to those challenges. Please mark your calendar for September 18th, again, noon Central Time. And with that, I'm going to ask Marcia, do you have any questions that you can share?
Yes, we sure do. One question is, how long has the industry been utilizing the enrollment process model?
Interesting. I love that question, don't we, Dina? Because Dina and I were instrumental in developing that model, and I want to say, is it 3 years ago, Dina, or am I kind of losing touch with times?
I would say 3 to 4 years.
Yeah. So that's how long that we have branded that particular model. We did a lot of research and recognized that there were very few resources available to help educate and train payer enrollment professionals, and that's exactly why we're delivering this series and why we created the model. We know that there's a gap in the industry for appropriate tools to help all of us.
Great. The next question. We were told by one of our managed Medicaid representatives that the Affordable Care Act mandated a 90-day enrollment period for payer enrollment. I've not been able to find the definitive answer. Is this true?
Dina or Yesenia, can you address that?
I think that just refers to the payer needing to process the enrollment within 90 days. That's what that would be my take on that. And a lot of times that happens, and sometimes it doesn't. So I've had experiences where enrollments can be processed, can take 4, 5, 6 months to be processed. So I'm not. I would have to research that further. Yesenia, do you have anything to add?
Right. Yes. For our state, I'm not aware of the 90-day waiting period pre-enrollment at all. I do believe maybe they were referring to the enrollment processing time.
That would be my take on it. The question, whoever submitted the question can submit a written question as well, and we'd be happy to try to address it.
Yes, one thing we do love is research. We love finding out what and how we can fix something, so we can definitely research it for you.
Perfect. The next question, what is your recommendation regarding a locum tenens staffing agency doing the enrollment for hospital clients? Is it recommended that the agency contact be the middle person and have the hospital do the entire enrollment?
Yesenia or Dina, can you address that?
I would need to research that. Yesenia, do you have anything to add?
Well, my experience is we do it internally at the hospital. We don't have a middle person do it.
And I can tell you that my experience is that primarily what I see in the field is that it is a hospital's organization doing the payer enrollment, but I also know that there are some high quality locum tenens agencies that are beginning to do, or at least researching, to take that responsibility and help again onboard these practitioners in a more expeditious manner. So if you're aware of a locums vendor doing that, again, using our contact information and letting us know, because we love to share information for other people to benefit from.
Perfect. The next is kind of a comment. Having worked for insurance companies, on their end, I would like to note that it is important to find out the insurance company's timeline. If they say they don't even look at a submission within a month, it will use up their resources to have to answer any questions on the application before then. This is a huge problem on the insurance end of the process.
Is there a question, or was that really a statement?
That was just a statement.
Okay. Okay. I would totally agree.
Yeah, I was going to say, Dina, what is your perspective? Do you have that same experience and what was shared?
I do. I have multiple provider type clients that have had issues with payers. They say that they process an order of received. So an application can literally sit for a month or so, maybe even longer, unfortunately. So it's kind of a matter of the squeaky wheel when I have that situation happen. I just keep bugging and bugging and bugging and, trying to get some sort of movement going. It is challenging. I will totally agree.
And the person who posed that statement has, I think I heard this properly, Marcia, is that they're coming from a health plan background. So that's been their experience as well.
Yes. Yep. The next question, is there a provider enrollment certification? And if so, do you have a website to recommend?
There is.
Oh, gosh. Yeah.
Yes. On Decision Health website. It's the Provider Enrollment Specialist Certificate. It's not an actual certification, but it's a certificate that's based on, I took it and passed. It's a 50-question test that is offered through Decision Health. So
I didn't know you did that, Dina. Congratulations. Good for you.
Yay. I didn't know either. Yay.
And just as a sidebar, I have had conversations with NAMS leadership with regards to NAMS offering a payer enrollment certification. And they referred me to the certification board. And I don't mean to misspeak, but I want to convey to the listeners what I was told. Because there is no certifying agency or accreditation agency for the payer enrollment process. So for example, the credentialing field has Joint Commission, has CMS, has DNV to set expectations and for a credentialing expert to be required to follow what those regulations and standards say. The payer enrollment industry or arm of our industry doesn't have authoritative bodies in which they can write exam questions toward. So they said that they would continue to pursue, but if any of our almost 500 listeners are aware of some authoritative body, that I'd be happy as a past president of NAMS to share that with them, because I get that question frequently from the field. Why isn't NAMS offering a certification for payer enrollment?
Good to know, Donna. I have something to add to that. I have read, and I don't know if this is true, there have been conflicting reports, but Decision Health, from what I understand, is considering a provider enrollment certification, and it's possible if you get the certificate now that you may be grandfathered into their certification program. I don't know if that's 100% accurate, but that is what I've read and I've heard. So whether or not it's true as of today, I don't know, but it is that's been a possibility that I've heard.
Interesting.
Okay, I know we're after 2, but there are definitely a few more questions. Is there a way to hold the insurance carriers accountable when they make an error or delay in applications?
I hate to seem cynical. That's kind of like going up against, probably not. I'm not really sure. I guess file a complaint with the insurance commissioner. That could be a possibility. Yesenia, do you have anything to add? I mean, I kind of think that's a losing proposition.
The only thing that I'm sorry to interrupt you. The only thing that they've done when they mess up was backdate to the date that we requested, but that's as far as they'll give in to anything else.
You know, that might be a good tee-up question though to ask at the NAMS conference with our panelist from the health plan.
Mm-hmm.
Perfect. The next question, do you have processes or recommendations for very large health systems with thousands of providers related to automated processes, rosters, databases, et cetera?
Credentialing software.
Yeah. Mm-hmm. I mean, that truly is. I mean, credentialing, the leading credentialing software companies have payer enrollment models, or is that the word I want? Modules. They have payer enrollment modules. So I would begin to explore whatever that health system's software is. Do some investigation with that carrier or vendor, and ask to have a demo of their payer enrollment piece, because managing that manually, and we know it's happening in the field, right? But being able to manage it electronically is going to improve your efficiencies, hands down.
Absolutely, and make sure you're part of that conversation when the large organization does start looking at credentialing software or provider enrollment software. Make sure you insert yourself in there, because you're the one with the knowledge, so you have to be in the room.
Very good. And do you have a website you can recommend as a good tool to help with people in this field?
Oh, that's the $1,000,000 question. I don't, and that's why we put together these educational programs, because there really is a lack of, a go-to source. But, Dina and Yesenia, do you have maybe perspectives that I don't see out in the field?
Are we speaking of a website for a resource for payer enrollment?
Mm-hmm.
Kind of unclear on the question. So I'd say keep tuning in to our webinars and Team Mobile resource. I don't have anything to add to that.
And stay tuned, because that's exactly what the Payer Enrollment Institute is all about, is providing a source where anybody in the industry, if they want training and education, they contact us. So I think I like that Dina's suggestion, just stay tuned to these webinars. And I know when you have such a need, or your team has such a need to understand how to do this better, we're doing the best that we can and as fast as we can to provide education out there. We recognize there's a gap, but the good news is we've heard the need, and we're truly trying to respond.
Okay, and then there are a lot of questions about, are the slides available to print for referencing later? And I can answer that one. Yes, they are in the handout section of your dialog box. If you click on the little sidewards triangle, you'll get a drop down of today's attendance certificate, the PowerPoint, as well as the NAMS certification. And the other question is, Dina, do you know what the certificate is called on Decision Help, and how people can find information on how to go about getting that certificate?
It's called the Provider Enrollment Specialist Certificate. It's PESC, and they can go to, if you just look it up, Google it, and Decision Health, and it should come up, and all the information is on their website.
Perfect. Well, I think that's all the time we have for questions today. I really want to thank Donna, Dina, and Yesenia. Very informative program, lots of great energy. And thanks to everyone for joining us, and happy summer to everyone. Have a great day.
Thank you.
Thank you.
Bye, everyone. Bye.